It's another day with the physicians where your health is our business. Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high, that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program.
Universal health coverage, simply put, is for everybody, irrespective of age.
Atrial fibrillation is a heart condition that causes an irregular and often very rapid heart rhythm that can lead to blood clot. It is actually a problem of the heart's electrical activity. It begins in the heart's upper chambers, also known as the atria. Symptoms include fatigue, heart palpitations, trouble breathing, and dizziness. Atrial fibrillation is one of the most common arrhythmias. Risk factors include high blood pressure, coronary heart disease, and having obesity. Untreated atrial fibrillation can lead to a stroke. The condition is more common in females than in men, despite the fact that females live longer than men. They are more at risk of heart attack and death. On your favorite health TV talk show, The Physicians, we will be discussing atrial fibrillation, the causes, the symptoms, diagnosis, management, and prevention. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agberie, your regular anchor on this program. Today we're going to be discussing atrial fibrillation, the symptoms, the causes, the diagnosis, the management, and of course prevention. In the studio with me is a regular face, our one and only consultant cardiologist, the MD, CEO, United Heart Hospital here in Lagos, no other person than Dr. Eugene Nwosu. Doctor, you're welcome to the program.
Thank you for having me.
Each time we know we have a cardiology case that we need to discuss. It's only very exciting knowing that you are going to come on the program. So we'll start with atrial fibrillation, okay? So you want to give us a general overview. What is atrial fibrillation?
Okay. Atrial fibrillation is the commonest arrhythmia. Arrhythmia means an irregular heart rhythm.
Okay.
If the heart rhythm is fast, that's an arrhythmia. If it's slow, that's an arrhythmia. If it's irregular, that's an arrhythmia. And atrial fibrillation occurs generally 5 out of 1,000. So the incidence is 0.5%. So across the world, that's the average. Now, atrial fibrillation occurs only 2% of the time in people that are less than 65 years old. But as you get older, the incidence increases. Above 65 years of age, the incidence is about 9%. However, among people that already have atrial fibrillation, 70% of them are between the ages of 65 and 85 years.
Wow.
Okay, and atrial fibrillation occurs in both men and women. The incidence in females are higher because females live longer than men. That is why it's more common in female. And one other thing about females is that they don't tolerate atrial fibrillation well.
Okay.
So they tend to have more symptoms, more mortality, and more morbidity.
Okay.
So in a nutshell, that is the definition of atrial fibrillation.
So what is going on in the hearts of someone who has an atrial fibrillation compared with one who doesn't have it, like a normal heart?
Fantastic. So basically, in a normal heart, the contraction or the electrical activity starts in the upper chambers.
Okay.
Okay, there are 2 upper chambers of the heart and there are 2 lower chambers. And the electrical activity starts from the upper chamber on the right side and travel down through electrical pathway that spreads to the lower chambers. Okay. And the upper chambers contract first, okay, followed by the lower chambers. So it's like a sequence. The upper chambers contract and the lower chambers follow. Yeah. In atrial fibrillation, there is an abnormality. Okay. So the upper chambers are fibrillating, they are quivering. There is not an effective contraction. Okay. So they are quivering, so they're actually not in sequence. Okay. And that can affect the overall performance of the heart. For example, when the upper chambers contract, they push blood into the lower chambers, and the lower chambers will now contract and push blood into the circulation on the left side. On the right side, it pushes to the lungs. When you have atrial fibrillation, you lose that final push
to the lower chamber.
To the lower chamber. So that means that the effective volume you push to the circulation is now reduced. So your cardiac output or stroke volume decreases. That can result in lower blood pressure, like, hypertension. That can result in blood pulling back in the lungs, leading to heart failure. And that can also result in feeling weak and tired and loss of energy. So these are the result of the abnormality when you lose the atrial contraction. The other thing that this causes is that you now, because blood is not, the atrium is not contracting and is quivering, the blood can pull inside it and forms a blood clot. And when that blood clot dislodges into the circulation, if it's in your brain, you have a stroke. If it goes into the lower extremities, you have a blood clot in the legs, what we call ischemic foot. If it goes into the arteries of the intestine, mesenteric arteries, you have a very serious, abdominal pain that can cause mesenteric ischemia. It's a terrible disease to have. So this abnormality results in a lot of symptoms.
Okay, what are the symptoms?
And of course, complications. Okay, so these are how atrial fibrillation behaves. Now, the next thing to talk about with atrial fibrillation is what are the causes of atrial fibrillation?
Sure.
Number one is that any problem with the heart muscle, like heart failure, can result in atrial fibrillation. Enlargement of the heart can result in atrial fibrillation. Myocardial infarction, like heart attack, result in atrial fibrillation.
What is myocardial infarction?
Heart attack. Okay, heart attack.
Like a blockage?
Yes, you know, the arteries are clogged up, and then because it's not getting enough blood supply,
so part of the heart muscle,
part of the heart muscles dies. Okay, that's what you call myocardial infarction or heart attack. If you have congenital heart disease like hole in your heart, VSD, ASD, and the blood is mixing from the left and right, that can result also in atrial fibrillation. If you have damage to the heart valves, like the mitral valve is damaged, or the aortic valve, or people that have rheumatic heart disease, which is actually a very common condition in Nigeria that damages the valves, that can result in atrial fibrillation.
Where do you have these valves? You're talking about ASDs and valves here. So
well, just simply so that we can stay focused in this, okay?
Yeah.
In the heart, there are 4 valves in the heart, okay? On the right side is the mitral valve. I mean, on the left side is the mitral valve. Blood coming from the left atrium into the lower left chamber.
Yeah. The left ventricle.
Okay, left ventricle, that can cause that. The aortic valve, so any of these diseases affecting the valves can cause atrial fibrillation.
Good.
Okay. Now, if you have high blood pressure also increases the risk of atrial fibrillation. Diabetes can cause that. If you have thyroid problem, especially excessive thyroid, like what you call hyperthyroidism, that can cause atrial fibrillation. If you have inflammation around the heart, like pericarditis, that can cause atrial fibrillation. If you have diabetes, that increases the risk of atrial fibrillation. If you have kidney failure, that causes that. If you have lung disease,
looks like everything is.
If you have sleep apnea, people that snore heavily when they sleep is like it's a freight train. Okay, they have sleep apnea. That causes that. And finally, people that have a family history of atrial fibrillation. There are also certain conditions that can cause atrial fibrillation. Mental health. People that have serious mental disease. People that drink a lot. Like college students, they go for a weekend and they have heavy dose of alcohol. They can actually have what we call holiday heart syndrome. They start having irregular heartbeat. Okay, excessive stress, mental stress, okay, can also cause atrial fibrillation. So the causes of atrial fibrillation is actually quite...
Excessive mental stress.
Absolutely, that can lead to that.
I think we all
and also people that take excessive caffeine, okay, like certain people are predisposed to irregular heartbeat when they take caffeine or any of those. So if you take those things and your heart is palpitating, just slow down because you can't tolerate that. Okay.
So in the course of the discussion, you talked about some of the causes. You did mention, the symptoms. Do you want to just expatiate on that?
Absolutely. Now, symptoms of atrial fibrillation include palpitation, like your heart is beating fast, especially when it is irregular. Okay. It can also cause chest pain because the heart is going very fast and then you start having some heaviness or tightness in your chest. You can feel dizzy, and sometimes you can actually faint. Fainting can come because atrial fibrillation is so chaotic that sometimes it's too fast, sometimes it's too slow. Okay, when it's too slow, you can actually faint and collapse. When it's also too fast, that can also make you collapse. Then you can also have heart failure from atrial fibrillation that is going very fast. That can put you into heart failure. Atrial fibrillation can also make you feel tired or loss of energy. What you used to do before, you could not do that because you are so tired and weak. And some people, when they go into atrial fibrillation, their blood pressure becomes low. So especially people that have high blood pressure and their heart muscles are thick, what we call left ventricular hypertrophy, they don't tolerate atrial fibrillation well. Once they go into atrial fibrillation, boom, they are so tired, they are so weak and fatigued. So these are all the symptoms of atrial fibrillation. Now, some people will present with stroke for the first time. They're having a stroke, and when you now try to find out the reason for the stroke, you now find out they have atrial fibrillation, which also tells us that sometimes atrial fibrillation will be without symptoms. People don't even know they have it.
So it can be asymptomatic.
It can be asymptomatic, and that is why regular checkup, at least once a year, even if you feel well and everything is fine, get checked up once a year, because it's very easy to make a diagnosis of atrial fibrillation.
Okay, so once a year at least it is recommended that we do our usual checks.
Absolutely.
To be able to pick out some of these challenges. So just hold it there, because when we come back, we need you to tell us more about the way it can be diagnosed. Diagnosis, then we'll go into the complications. So we need to keep a date with the physicians out there. Let's hear what you have to say about atrial fibrillation, anxiety, palpitations. Have you had that before? Do you have hypertension or diabetes? Any of those diseases, you are at risk of having atrial fibrillation. Let's hear from you when we keep a date with the physicians. We'll be back after this short break.
Located at the left-hand side of my chest.
It's located at the right side of your chest.
My heart is located at the left side of my chest.
On the left side of the chest.
Stress, anxiety, worry, and some other factors.
Well, when you pant too much, or you run, or you are scared of something.
Maybe when during sports, or BP, or maybe shock.
Fear can make your heart sound abnormally, and anxiety, if you are anxious or something, your heart beats very fast.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. So, Doctor, I'm sure you have schooled us a whole lot on atrial fibrillation. At the end of this program, we actually can become authority. So let's go, because you talked about the causes, the symptoms. So maybe we'll talk now on the diagnosis. How is the diagnosis of atrial fibrillation made?
Okay, one point I'm going to add before we do this is one of the greatest risks of atrial fibrillation is stroke. Okay, people with atrial fibrillation, their risk of stroke is 5 times higher than people that don't have atrial fibrillation. So stroke is a very, very scary presentation of atrial fibrillation. And in order to increase their risk of stroke, there are certain problems if you have it. If you have those diagnoses, your risk of stroke goes very high when you have atrial fibrillation. One of them is if you have heart failure already, if you already have heart failure, it's a risk of stroke. If you have high blood pressure, it's a risk of stroke. Okay? If you are age 75,
and above,
much higher. Okay? If you're a female, just being a female is a risk factor. Are you getting me?
I don't think I like that.
Now, if you had stroke already, the risk increases. Okay? So there are several, and also diabetes. Okay, if you have diabetes, the risk increases. So you can see if you have atrial fibrillation and you're adding all these things, your risk of stroke is extremely high. We're going to talk about, when we talk about management, how to manage this so that you don't stroke out if you have atrial fibrillation. Okay. Now, diagnosis is actually very simple. Diagnosis starts by history. You listen to patient's symptoms. It might tell you the heart is fluttering, jumping out, irregular. So you take note of that. You check the pulse, it's irregular. Now, you do some basic blood tests. You check for thyroid, because I told you that thyroid disease can cause that, because if thyroid is the problem and you treat the thyroid, atrial fibrillation is controlled. Okay, so you do that. You check for electrolytes to make sure the potassium and all the magnesium, all these things are normal. Kidney failure, do they have kidney failure causing the atrial fibrillation? So the blood tests are important. Okay, now you also do an ECG. ECG is very key because it's the electrical activity
of the heart.
And then it can tell you that. Now, sometimes people have atrial fibrillation that comes and goes. And that's when heart monitor is important. Heart monitor is an ECG that records the heart for 24 hours. It can give you a lot of information, including how fast the heart is going and how slow the heart is going. All this information will help you in proper management. Now you come echocardiogram. Echocardiogram is key because that's going to give you, it's an ultrasound of the heart that gives you information on the structure of the heart. Okay, what are the enlargement? The two upper chambers, the atrium, are they very enlarged? That's an important information. If you have atrial fibrillation where the two upper chambers are not enlarged, that is actually a good sign, because that means you can flip it back to normal rhythm. You look at the ventricles. The left ventricle, is it thick, like left ventricular hypertrophy? What is the heart function? What is the ejection fraction? What is the strength of contraction? Is there any valvular heart disease that is causing it? Because, so, is there pericarditis, inflammation of the pericardium? So the echocardiogram can give you a lot of making the diagnosis. That is very important. Then chest x-ray. You can also get chest x-ray. Okay, these are the very basic tests that can give you diagnosis of atrial fibrillation. Okay. And once you get a diagnosis, now you now focus on management. So, in managing atrial fibrillation, the first thing to do is when you know the heart rhythm, if it is very fast, being very fast will make the patient have a lot of symptoms. You want to control the heart rate.
Sure.
Sometimes atrial fibrillation, the heart rate will be going at 160 to 180 beats a minute. That is pretty fast.
It's very, very fast.
And like if your heart is doing this, you won't tolerate it. After a while, you're going to heart failure. So the first thing to do is to slow it down. There are certain drugs to slow down the heart. Sometimes, if the heart is very fast and the patient is very sick, in other words, their blood pressure is low and their heart failure, you can do an electrical cardioversion where you basically shock the patient, shock the heart, and correct that.
That's what you call
that is what we call cardioversion. Okay. So the first thing is to slow down the heart. The second thing you do is you try to change the heart rhythm back to normal. But before you do that, for people that have been in atrial fibrillation for some time, before you try to change the rhythm to normal, you must give them a blood thinner because some of them may already have a blood clot. Okay, if you change the heart back to normal without
doing the thing, giving the thinner,
without giving the blood thinner, they can just stroke out.
Wow.
So you slow down the heart. Okay, you start them on a blood thinner. Okay, that blood thinner should be taken for at least 4 weeks before you think about changing the heart rhythm back to normal. So slow down the heart with medication, you give them a blood thinner. Especially if they have all those risk factors that increases the risk of stroke. Are you getting it?
Yeah.
So you do that. Now, if they now have other correctable factors, like they have hyperthyroidism, you give them, you treat that. If they have sleep apnea, people that have serious sleep apnea causing atrial fibrillation, you need to treat the sleep apnea in order to correct that. So these are that. Now, there are certain other things you do depending on presentation. If people have atrial fibrillation that is very slow, the heart rate goes down to, let's say, 20 beats a minute, those people will collapse, pass out, and faint. If that is the case, the treatment for atrial fibrillation now is a pacemaker. Okay. They need to now have a cardiac pacemaker. It's a minor surgery that you put a wire into the heart and give that pacemaker generator an instruction. I don't want the heart rate to go below 60. If the heart rate goes below 60, it starts, pacing them. Anytime the heart recovers and start going normal rate, the pacemaker slows down. So pacemaker is a standby generator that can be used for atrial fibrillation that is going very slow and patient is passing out. There are other procedures also that is surgical. Sometimes it is ablation, pulmonary vein isolation and ablation therapy that can cure atrial fibrillation that has not caused very large atrium, enlargement of the chambers that is coming from.
Okay.
If they are very enlarged, then you cannot use ablation therapy. There are also other people that are going for cardiac surgery. It might be for valve surgery, it might be for coronary bypass surgery, but they have atrial fibrillation. At the time of doing those surgery, the surgeon can also do what we call a maze procedure, where they put a scar or cut the pathway that atrial fibrillation might be flowing, and that can actually stop it.
Wow.
So these are things that can be done at the time of other surgical procedures.
Oh,
So there is a lot of technical stuff, but just using the medical therapy to slow down the heart rate, control stroke with blood thinners, and at some point use medication to convert it to sinus rhythm can actually make a big difference.
Like hyperthyroidism.
If you treat all those things, if you cure sleep apnea, all those things, if they have valvular heart disease and you fix the valve, atrial fibrillation can be controlled.
Okay. Well, time is just fast spent, but I won't let you go without telling us one or two things about the complications. What are the possible complications that can arise?
Okay. Basically, the number one complication of atrial fibrillation is stroke. And that is one that is very scary. It can happen without symptoms. Okay. And atrial fibrillation can also cause myocardial infarction, heart attack. Okay. It can do that. Atrial fibrillation can cause heart failure. Okay. Atrial fibrillation can cause blood clot going to other areas of the body except from the vein. It can go to the brain for stroke. If it goes to the legs, you have ischemic foot, okay, where you have loss of blood, and you can actually lead to amputation.
Wow.
So all those things can be controlled with proper management. But before we go, you can use lifestyle to actually prevent atrial fibrillation or to manage it. All the proper things: good diet, losing weight, controlling blood pressure, treating diabetes, stop smoking, stop drinking, get enough rest, regular exercise. All these preventive measures can make a difference.
All these preventive measures can actually make a difference. Thank you so much, Dr. Eugene Nwosu.
Thank you.
It's been nice having you again, school us on atrial fibrillation. We cannot always have enough of you when you come to the studio. So on that note, I want to say thank you so much for being part of our program today. Ensure you keep it there with us again next week on your favorite TV health talk show, The Physicians. I remain Dr. Martina Agbere. But then remember to follow us on social media handles, Facebook, Instagram, and Twitter. If you want to be part of this program, just send us an email. Go to our website and fill that form, and you'll be invited. Till next time, stay blessed.